This is one of the many funerals being held at villages and cities across Zimbabwe. Every day, the number of people being infected with cholera is rising, and nearly 9,000 cases have now been confirmed by the United Nations.
The figures that have been released so far, or the figure that we have had access to, are pointing towards a 10% death rate of those that have been affected by cholera. And to date, I think reliable sources tell us that at least 6,000 people have been affected by cholera in one way or the other. So one can safely say the numbers are anywhere in the region of 500 to 600 people that have succumbed to cholera. And that indicates that there's been underreporting, whether that's lack of information on the part of the government or it's lack of awareness of the existence of people that are dying at home. One has to, to find out.
Most of the cholera-related deaths in the country have been in impoverished districts, and hundreds have been treated for the highly infectious intestinal disease spread by contaminated food and water. The UN Humanitarian Coordination Office in Geneva says that cholera has spread to more than half of the country.
I can't say that enough is being done, because, but by enough we're looking. If we take the disease of cholera, for example, it's not just waiting for patients to come to the established places where for treatment. You're looking at preventive measures that are going to be put in place. So by this I'm talking about there's need to address the sanitation problem in the urban centers, in the areas that cholera has appeared. There's raw sewage still flowing on the streets of most of the urban areas. There's a lot of garbage which is littering almost all the urban centers.
The World Health Organization says it fears cholera could spread further and has sent medicines and rehydration salts to Zimbabwe. Infrastructure has been left to crumble for months, with the politicians deadlocked over forming a power-sharing government. And as the political and economic crisis in Zimbabwe deepens, most hospitals have been forced to close their doors as they can no longer afford drugs, equipment, or to pay their staff. The government of Zimbabwe has rejected calls for it to declare a state of emergency over a cholera outbreak.